The Center for the Improvement of Human Functioning International presents this luncheon lecture. Today's topic, Oxidants and Antioxidants, the battle for your own body. Your presenter, James A. Jackson, MT, ASCP, Ph.D.
Thank you all for coming. Since this is being recorded and transmitted sometimes different places of the world, Dean told me that I could not tell any of my risque jokes anymore. So what I will tell you is a conversation I heard out at the Town East Mall. My wife was shopping, so I was sitting at this little bench, and this one lady was coming out of Sears. The other lady was coming towards her, and they saw each other. And she says, Mary, what's going on? You look sad. She said, well, yesterday morning at breakfast, after 20 years, my husband told me that he needed more room, more space for himself, and then he left and went to work. And she said, my God. She said, what did you do? She said, I locked him out of the house. Which is a good way of giving him more space and room. Our lecture today is Oxidants and Antioxidants, battle for your body. As you're sitting here eating or thinking and stuff, there's a terrific battle going in your body. It's just as great as any battles fought during World War II or stuff. At the cellular level, the molecular level is where this is taking place. Things are trying to destroy your cells. Things are trying to protect yourself. And we call this oxidative stress. Normally we like for our oxidation and antioxidation to be like this. It's like a seesaw. Sometimes it goes like this. Sometimes it goes like this. And we'll talk about what these things are. Oxidation, a good example of that. If you ever cut a potato and an apple and you didn't put something water right away, it starts turning brown. That's oxidation. If you put it in water, it stays perfectly clean. There's no oxidation. So this is exposed to oxygen, which is turning it brown. Apples will do the same thing. Skin will do the same thing. Everybody look at your hands. Are you seeing any brown spots on your hands? Or like something like this up on my head here? What does it look like? Rust? Okay? Rust? This is actually a form of rust. As a car rusts, your body will rust. This helps us at the cellular level. People call me rust head, but I don't pay any attention to it. Now, look at the bottom part of this. This is for information only. I'm not giving you any discussion of medical problems. Don't go to your doctor and say, Dr. J says I'm rusting away, because I'll deny it. So this is for your information only. If you have any problems, talk to your physician. Here's some objectives that I'd like for you to know about. At the end of this lecture, you should know what a free radical is, oxidant or an antioxidant. You should know where they come from, how they damage or protect your body. Some diseases caused by these free radicals. A radical is an oxygen-like molecule that has lost an electron or gained an electron, and when it escapes from the place where this happens, then it's a free radical. That's why we call them a free radical. They move from the place where they were damaged. We're going to talk about some diseases caused by the free radicals, how to diminish the damage caused by the free radicals, and some of the cell dynamics. And all these pictures at the bottom are some of the things. As you get older, these things tend to come more often, and under stress or stuff like this will cause these problems. Definition. We just talked about this. Free radicals are also called oxidants. Some free radicals come from reactive oxygen species, and this is like hydrogen peroxide. It's a reactive oxygen species, but it breaks down into a very, very potent antioxidant, which is hydroxyl oxidant. They're good, some are bad. By sitting there breathing oxygen, you are generating free radicals. About 1.7 tons of free radicals a year. This is air, for God's sakes. So see how much you're generating. Just by breathing oxygen, you're generating free radicals. And we'll talk about some of these in a moment. Generated as a result of stress. You have more stress, you have more free radicals. Outside the body, things can cause it, such as smoking, any type of pesticides or fertilizers or smoke from stuff. And the oxygen there, I show you what it looks like. It's 2 oxygens, atomic numbers there. Now what are they? Why do they hurt us? These things are unstable oxygen molecules lacking an electron, or some of them have an extra electron, and these things are like moving magnets. They're going through your body trying to pick up an electron from another cellular component. And by doing this, they'll hurt your cell membrane, they'll hurt your cell nucleus, and they'll hurt your cell cytoplasm. So eventually, over a period of time, say years, you'll start seeing a lot of this stuff. Now, here's how we can find out how these things work. When I was taking organic chemistry, I could never get oxidation and reduction straight. I always wanted. So this professor said, James, he said, you ever heard of Leo the lion? I said, oh my God, this guy really thinks I'm smart. And I said, yeah. He says, what do they do? I said, well, they growl. He said, no, think of GER. So he says, Leo, you lose an electron, it's oxidized. If you GER, gain an electron, it's reduced. That's how the organic chemistry stuff. So a week later, he gave a test. There was 10 questions. He said, circle the ones that are oxidized, draw a square around that is reduced. I had no clue. I wrote underneath it, Leo the lion is growling. He gave me a 0, said, nice try. You know, but this is how things happen. Now, what is oxidation? Everybody see their old car sitting in the back, or an old bicycle, or an old piece of iron? Oxidation is what causes the iron to rust. Old rubber tires that sit on your car that you don't drive, or sitting in the garage, or an old slingshot that you haven't used for a long time. Rubber turns brittle. Anybody have an old piece of steak or bacon or meat that really stunk, turns rancid? That's oxidation. Apples, I just showed you, potatoes turn brown. That's oxidation. Now, if your body does not neutralize or destroy these free radicals or oxidants, your body will rust away, just like a car. See these little rust spots on my head? See on your hand, little age spots? That's rust spots. Your body is rusting away. This takes place inside the cell as well as out. Most of this stuff is caused by sun and stuff like this. So if you have oxidative stress over a period of time, you're going to rust away just like your car. Now, a guy named Denham Harmon in about 1954, who was from Kansas, postulated this free radical theory was related to aging. Aging. So there's pretty good proof that free radicals and oxidation will cause premature aging. You go out in the sun a lot, or you smoke a lot of cigarettes, you start to wrinkle a lot. Wrinkling of the skin, hardening of the arteries, arthritis, cataracts, macular degeneration, cancer, various CNS diseases like Alzheimer's and Parkinson's, and a lot of this stuff has already been documented in data. I mean, all kinds of journals. I'm not making this stuff up. And other degenerative diseases. So this usually takes place over a long period of time. You know, if you look at cancer, it used to be a little blip when you're in a young age from leukemia. Then for years, there wouldn't be any, and then 65, it'd go like this. This happens because of oxidation damage to your DNA, where you cause mutations, and cancer will develop. One of the things, it's all called atherosclerosis and stuff like this. Now this is a typical cell with the structures on it. This is a, remember, all this battle that's taking place in your body is taking place here at the cellular level. And this is what your protection mechanism is. You've got these enzymes here, superoxide dismutase, and notice that every enzyme here has a mineral. How many minerals can you make? None. None. So you got to get these into your diet. Iron catalase breaks down hydrogen peroxide. And then you got glutathione peroxidase over here. This contains 4 selenium atoms. And then you've got manganese superoxide. That's your first line of defense. So you need all these minerals, and these minerals are what we call transitional elements. They're able to give up an electron so they can neutralize the other things. And the second line of defense are your fat-soluble and water-soluble vitamins. Vitamin E and beta-carotene go down on the lipid membrane. Once you have an oxidation started here, it's self-perpetuating. If you don't stop it, it's going to destroy your whole cell membrane. This is why beta-carotene and vitamin E that's very long, they'll go down there and stop it. You got glutathione, which is a very powerful antioxidant. You got vitamin C, B, E, and beta-carotene, and then vitamin E. Anything is lipids, things you have a fat-soluble vitamin in your DNA, vitamin E. So your second line of defense are all these fat-soluble and water-soluble vitamins. Most of your free radicals or oxidants are generated here in your mitochondria, which is a powerhouse. Now, some of these things are good because if this is a macrophage, it would go, if there was a bacteria here, this thing would go out and engulf that bacteria, put it in here, and generate free radicals and kill it. So free radicals is how the body kills cancer cells and also bacteria and stuff like this. So all free radicals are not bad. But this is what your cell, this is where your battle is being fought at the cellular level with molecules and stuff like this. The stuff you're eating is pretty good, but it's got to be broken down in all these components or it's not going to work. Now, these are what we're talking about. This is superoxide anion. Notice it has this little minus sign on the thing. This is a free radical. Just by breathing oxygen, you're generating this stuff. Hydrogen peroxide is a reactive oxygen species. This thing breaks down to this one here, which is a hydroxyl free radical. And this thing is the most damaging of all of them. And these things only last microseconds. I mean, they're not there for minutes or hours. They're only there for like this, less than that. But in that short time, they can cause a lot of damage. And this is the singlet oxygen, which sunlight and stuff will generate these. You know, when you go out and get a bad sunburn, that's oxidation. Skin starts peeling. Suntan, oxidation. Nitric oxide, free radical, actually comes from arginine, which is an amino acid. This thing's only been around since 1981 when they first discovered it. It's good and it's bad because if you take amyl nitrate, it's converted to nitric oxide, which causes vasodilation. So this is a good part, and sometimes it's a bad part. But this comes from arginine. So these are the things that your body has to fight. This is the enemy. This is what's trying to kill your cell. And then the things we talked about before is what's trying to protect your cell. And we'll talk about some more of this stuff. This is what causes them. Smoking, either cigarettes or other smoke, chlorine, alcohol. Emotional stress is very bad. It's been shown by various psychological studies that just thinking about something, a stressful situation, causes more stress than the actual situation. If you're afraid you're going to be losing a job, or if you're afraid you're going to get a divorce, or somebody is sick, just thinking about that is more stressful than the actual situation. And stress is responsible for a lot of our oxidation. Radiation, when they give you radiation for cancer or something like this, they're producing oxidation. That's what kills the cells. Pesticides, toxic chemicals, sunlight, go out in sunlight too much, you'll get suntan, you get sunburn, and then eventually you'll get basal cell carcinoma, squamous cell carcinoma, myeloma, so this stuff is all oxidant. Pollution, the stuff we breathe in and are exposed to, carbon monoxide, a little bit will cause this, a lot of it will kill you, and food preservatives. And kids especially, they're finding more and more relationship for preservatives and food coloring dyes with ADD, ADHD, and autism. It's coming to be more and more. And processed foods has so many preservatives in them you wouldn't believe. So all of these things can produce free radicals. The stuff that you're eating has no preservatives. The stuff you're eating has no pesticides because we have our own certified organic garden here. And when you're looking at stuff to eat, if you look at the color of the rainbow, if you got more than 4 or 5 colors on your plate that you're eating, you're doing good. But remember, eating is the first step. What do you got to do with that stuff after you eat it? Digest it, absorb it, metabolize it, and excrete it. So if you got a yeast problem, irritable bowel syndrome, low stomach acid, what you're taking in is really not doing you a lot of good. You got to measure the blood, which is what we do out here, to see if you're really absorbing it. So that's only the first step. These are the things that commonly cause these things that are trying to kill us. And we talked about the relationship of free radicals and oxidants and aging. This is the leading cause of death in people 65 years or older based on race. Notice that the first two are heart disease and cancer. Now, for about 40 years, the drug company's been saying, lower your cholesterol, lower your HDL, raise your HDL, lower your triglycerides, exercise, don't have diabetes, And it's still the leading cause of death in the United States. So what's going on? If you did all these things, theoretically this thing should be down here. But it's still the #1 cause of death in the United States, as opposed to all these drugs and all these things that we're taking. Cancer is #2. It's directly related to, a very small part is genetic. A lot of this stuff is related to oxidation. We know if you go out in the sun, you're going to get skin cancer, right? We know this thing. Same thing happens in the other layers. And then stroke, depending if you're American, Indian, Native Americans, diabetes, but these. And then a lot of people don't realize how much these lung pulmonary things kill people. COPD, chronic obstructive pulmonary disease, and pneumonia. These things really think. And a lot of these things are caused over a period of time by free radical oxidation. This, of course, is a bacteria, stuff like this. But by the year 2010, cancer will be the #1 cause of death. We've been fighting the war on cancer for 37 years, and we have more people dying of cancer now than we did when we started. 80 to 90% of the money for cancer research goes to finding a new poison to treat cancer. If they devoted billions of that dollars to prevent cancer, or what causes it, it'd be a whole lot of money. But no, it's all. And if you live 5 years, according to the National Cancer Institute, you're cured. So they could put this treatment cured this patient of cancer. If you die 5 years and 4 months, you're cured, but you're dead. That's the way they mess with the statistics. Okay, we cured this patient, because they could say this treatment worked, because they lived 5 years. So these are the things, 65 years or older, and I'll show you another thing about that in a minute. And here's some aging facts we talked about. About 43% of Americans over age 65 will spend time in a nursing home at a cost of $40,000 to $100,000 a year. 1 in 25 people at age 65 will have significant vision loss from age-related macular degeneration. It usually runs in families, usually runs in people with blue eyes. Some common nutrients, vitamin C, E, zinc, copper, beta-carotene, reduce the risk of AMD because we are antioxidants. We're fighting all the oxidants, the UV lights coming in, all this stuff outside. Reduce the risk of AMD between 5% predicted against cataracts. Now, for years, Dr. Riordan prescribed a formula that had all this thing in it. He was called a quack. About 5 years ago, the National Eye Institute did a study where they used the same chemicals, same nutrients that Dr. Riordan used, and said, by golly, this stuff works. He was called a quack for 25 years, but then the Eye Institute did the same study, and they found out the same thing that he's been saying for 25 years. Dr. Riordan. Dr. Riordan, we're 25 years ahead of time. We've been treating cancer for vitamin C for 20 years, and 2 years ago the NIH finally did a study and said, dang, this stuff really works. This stuff really works. Oxidative stress, this is what we're talking about. If you expose to these oxidants, a lot of things happen, most of them bad. Now, if we can prevent or reduce the amount of these things, we're going to delay the onset of arthritis. We're going to delay the onset of heart disease. We're going to delay the onset of Parkinsons. We're going to delay the onset of degeneration, macular degeneration, or Alzheimer's. It's more and more data is coming out in literature about this. You can live longer and age better if we get rid of that. Continue. Dr. Bruce Ames, who is the guru of oxidants and antioxidants out in California, says that each of the 80 trillion cells in our body, they don't know that's 80 trillion. They're just estimating it's 80 trillion, because how can you count 80 trillion cells in your body? So about 80 trillion cells in your body suffer 10,000 hits from oxidants or free radicals a day. So every cell in your body is getting hit by these free radicals 10,000 times a day. So you've got to have something that's going to protect. This is the battle. This is the battle we're talking about. Your cells are getting hit. What do you think is going to happen to your DNA if you hit it 10,000 a day for 30 years? It's going to mutate it. If you mutate it, what's going to happen to it? It's going to turn into cancer or something. Right? Now, free radicals increase with age. An elderly person, I'm not going to define what an elderly person is. Just say I represent that remark. The elderly person has 9 times the frequency of mutations in their cells as do infants. Over a 70-year period of time, the body is said to produce over 17 tons of free radicals. This is 17 tons of air. You generate how much that stuff is that you generate. Not only for breathing oxygen, but all this outside stress that we were talking about. This is an article taken from Lab Science. It says, most all effects of aging and degenerative disease may be caused by oxidative stress. Oxidative stress. When reactive forms of oxygen are produced faster than they can be safe, this is the battle. They're produced faster than we can be safely neutralized by this antioxidant mechanism. And this is what really gets us. And I was talking about this before. This is oxidative stress, DNA damage, mutations, defective genes. It messes up the P21 gene and the P53 gene, which is apoptosis, where cell's going to die or not. If you inhibit the P53 gene, a cancer cell lives forever. Cancer cells are immortal. You have to kill them. They will last forever, whereas a normal cell only has a certain lifespan. And you have malignant changes. This is what happens in the DNA damage. The lipid damage, lipid peroxidation, destroys the cell membrane. You destroy the cell membrane, things kill. That's how we kill bacteria in your body. We give you an antibiotic. The antibiotic destroys the cell wall of the bacteria and it dies. That's how we kill them. Protein damage, oxidation, you have cross-linking, fragmentation, loss of function. This is what happens, we think, in some cases with Alzheimer's. You form this amyloid plaque in your brains, the amyloid plaque. And once you start cross-linking and fragmentation, these proteins, they are resistant to the proteinases, which normally will break them down. So they will stay there, like you're resting of your head here. So this is what happens when we say you have oxidative stress, where you're on a teeter board and the teeter board is teetering this way because of the stress. Okay, back to the slides. But I want everybody to see this stuff. How this is what happens in your cell. This stuff, this stuff, this stuff. Now, deaths in the United States. This is 2004. You can go click on the NIH statistics sheet, something like this, and they'll give you all this data, but the data is usually 4 years behind because it takes all that time to gather the data. This is how many people die in the United States. Over 2 million. Heart failure and neoplasm cause over half the deaths of people over age 45. Before you leave here, 144 people are going to die. Now look at this. Accidents and adverse effects from accidents, motor vehicles, are the leading cause of death in ages 1 to 45. Free radicals had nothing to do with that. We're going to hit a bridge or something, but this is amazing. It's about the 5th leading cause of death in the United States. Is accidents. Death rate for 100 people is 817. Life expectancy 77.8. This is male and females combined. See, this is another thing I don't understand. They say, well, the United States is in such bad shape, all these people are dying, all this stuff, yet our life expectancy each year goes up. It doesn't make sense to me. We should all be dying at age 40. So, the life expectancy in the year 1900 was 35 in the United States. In the year 2000, it was 70. So it doubled over that period of time. Infant mortality rate, 7 deaths per live birth. Now, we mentioned this before. What are antioxidants? A group of enzymes. We talked about those before with the minerals. Vitamins. How many vitamins can your body make? None. Little D from the sun, but not enough to keep you alive. There's 50 things you need to survive that your body can't make. God, in his sense of humor, gave us this wonderful body. He says, by the way, there's 50 things you need to live that I'm not going to give you. He has a sense of humor. So, minerals you can't make. Phytochemicals are very important. People say, well, I'm not going to eat this, I'm just going to take pills. We don't call pills replacements. We call pills supplements. They supplement your diet. They don't replace your diet. The best thing, there's stuff in your food that is important, we call phytochemicals, that we don't even know what they do. There may be something in there that you're eating that is protecting you from something. We haven't found it yet. Every time we do hair or RBCs or urine on people, we always find a little tin. Now, people say, well, that's a contaminant. How do we know it's a contaminant? It may be doing something in your body that we don't know about. I remember them saying the same thing about zinc. Me and Pasteur and Van Leeuwenhoek in the lab, when I first started out, they started, I'm not telling you how old I am or anything, but, they said, what in the hell is zinc? What does it do? We had to prove what it did. Now, these phytochemicals, things that you eat, significant delays, inhibits, prevents oxidation. Now, we just talked about before. You cannot make 50 things in your body that is used for antioxidants, for other things, energy and stuff like this. Cannot be made by the body. Must be obtained through the diet or as supplements. Notice this word. Not replacements, supplements. Eat the color of the rainbows. 5 different colors on your plate if you can, and you'll get all the phytochemicals that you need. Vegetarians are fairly healthy, except they're low in a lot of minerals because they don't get enough in their thing. Sometimes they have to supplement.
Are phytochemicals only found in plants?
No, people have breaking them out of plants and putting them in juices and stuff like this, but what we're talking about is the stuff that's in the plants. Phyto just means a plant chemical. You can extract it, and like some people do, put it in a bottle and say, hey, take this green stuff. It's good for you. If you eat lettuce and stuff, it's just as good. Plus you get the fiber. See, with the other stuff, you don't get the fiber. Fiber is very important for this stuff. Any health professionals in here that are willing to admit it? Okay. Oh, Dr. Ron, raise your hand. He's the ultimate health professional. Don't wave at him. Just give him a big head. Turn around. I'm giving the lecture here. He's not. He'll get me after a while and say, you shouldn't have said that, Dr. J. But it's on tape. Now, the antioxidant enzymes. We said you need minerals. We can't make them. Superoxide dismutase 1, you need copper and zinc. Zinc, copper. Transitional elements. Give up electron. Take electron. That's why they neutralize it. Superoxide dismutase 2, which is down in the mitochondria, use manganese. Manganese. Catalase, iron. Very important. This is one of the reasons our vitamin C treatment for cancer works. Cancer cells have 0 catalase. So if you flood a cancer cell with a whole lot of vitamin C, you generate hydrogen peroxide. Strong. You ever put hydrogen peroxide on a cut, see what happens? Well, same thing happens inside your cell. Since the cancer cells, vitamin C generates hydrogen peroxide. Since the cancer cells can't break it down, it destroys the cell. Doesn't affect the normal cells. Destroys the cancer cells. And glutathione peroxidase, it has 4 selenium atoms. This is why selenium is so good for you. So these are your first line of defense here. Normally this takes care of the normal stress. You have enough in your body that this is your first line of defense. If you're calm, cool, no problems, no job problems, no kid problems, no wife problems, no money problems, which is probably about 1 in a million. You don't have any of these problems. These are what's the second line of defense. This is your fat-soluble vitamins. People say, well, what is this? If you can remember this acronym from my old college professor days, ADEK, A-D-E-K, are fat-soluble vitamins. The rest, water-soluble. It's easy. The water-soluble vitamins are the C and all the B's. So these things are your second line of defense. And then you get these things from your food, the carotenoids, flavonoids, beta-carotene, lycopene, lutein, etc. Lycopene is the highest concentration of the carotenoid in all the tissues in your body. You get it from tomatoes, but better if you can get it from tomato paste or ketchup. The men in Italy have 65% less prostate cancer than men in Ireland, England, and the United States. Now, why is this? They spaghetti and all this stuff on the tomato sauce, you know. So it's also pretty effective against estrogen. Any type of hormonal type thing, like ovarian cancer, prevents that too. But these are, notice the colors of the rainbow. Each of the colors of the rainbow. You get all of these stuff. But you can't make any of this stuff. So, here's a question. I had this question a while ago from somebody before I started. How much should I take? How many antioxidants do I need? Well, first of all, how much do you have or need? How many people would go out to their car, raise up the hood, take the oil thing off, and put 3 quarts of oil in there? What are you going to do first? You're going to measure the dipstick, right? So we have a program here called Health Under Beat the Odds where you can actually measure the level of these things in your blood. And I've asked this question 100 times. How many people take your car down and get it checked every time it needs to be? You know, how many people, every 3 or 4, when you get your thing, you take your car down? How many people get your oil changed every 3? Okay. How many people get your tires replaced or rotated? Battery checked? Huh? All right. How many people have ever had your blood checked for nutrients? I mean, those are not fibbing. I ask people this question all the time, and I say, well, why do you do this for your car and you don't do it for your body?
Is there a name for that?
Yeah, stupidity. But they say.
If you ask your doctor for one of those, what's it called? It's not like a CBC or something like that. Is it?
No, they won't know what you're talking about. The nutrient panel. You take them back to them. What do they get in medical school? 8 hours of nutrition, and the whole thing's in medical school, and that's the RDA, the ridiculous daily allowance, is what I call it, which is the disease it's going to cause you to get beriberi, pellagra, and scurvy. That's it. Medical schools are disease prevention, not a health promotion. So I ask people, I say, why do you do this for your car you don't do it for yourself? What do they tell me? What do they tell me, Dr. Ron? I need my car.
So when you go and get a physical, and you go sit down with the doctor, and he's got these 90 pages he reads through.
That's skin profile and everything, and that's very few nutrients on them.
But there's nothing in that report that says what your mineral and stuff is?
Maybe if they specifically order them, but not on the routine chem profiles. The main reason is that Medicare, a lot of your insurance companies will not pay for this testing. Because they say it's experimental. They say, well, sure, it's important. They say it's experimental or research and not approved. We see it all the time. So, how much do you need? We'll talk about this in a minute. A lot of stress here. How many people ever relate to this sitting at your desk? Or this? Or this? A lot of exercise. If you exercise, you generate 10 times the amount of free oxidants or oxidative free radicals oxidants that you do sitting here at the table. So most people who exercise regularly have a very good diet. I mean, they take care of themselves. So they're combating this excess free radical. Activity, couch potato, you're just not doing anything is bad for you. As we get older, we talked about how much more, things like DHA go down, and you're more exposed to mutations. Male or female, depends on how much you should take or how much you need. How much you weigh, are you overweight, are you underweight? And your family history. If you have a history of somebody with Alzheimer's or Parkinson's or breast cancer or prostate cancer, there are things you can do to delay the onset of these diseases. And we have a thing called Health Under Beat the Odds. It's on our website, www.brightspot. Just click on it, show you what it is. So this depends on how much you should take. Now, here's another thing. You talk like you say, all right? I don't need this stuff. I get everything I need for my food. Okay? Here's a study by the USDA. On any given day in America, 41% do not eat any fruits or vegetables. 82%, including me, do not eat any cruciferous vegetables like broccoli or cauliflower, which are very good, very strong antioxidants. 73% do not eat any vitamin C-rich fruit or vegetables, but they were always over here eating these hamburgers and stuff like this. 80% do not eat any vitamin A-rich fruit or vegetables. Another hot dog take care of that. 84% do not eat any high-fiber grain foods. 89% do not eat the RDA of fruits. The RDA was 3 to 5 fruits or vegetables a day. Did not eat this. This is what they recommend you do a day. And the RDA is just to realize the RDA is designed to prevent deficiency diseases. If you take the RDA, you won't get beriberi, you won't get pellagra, you won't get scurvy. It doesn't say anything about doing good health. You need 10 times the RDA, in my opinion, to do good health. That's why I call it the ridiculous daily allowance. Do antioxidants work? Drug companies say no. They don't want to hear this. Why? If you can cure something with vitamins and minerals, you're not going to sell a drug. And here's some data shows you that. The risk of stroke is 73% lower in people who consume the most bioflavonoids than the lowest. This is the stuff that was in the foods. Men with lower selenium levels had 4 times the risk of dying from stroke than those with higher levels. Selenium is also 200 micrograms a day, is also shown to prevent the onset of cancer, 52% compared to a control group. And this was conducted by the government. Every morning I get up, I stretch, burp, take selenium. Then I brush my teeth. Does it work? The risk of having a second non-fatal heart attack was reduced 77% in men taking 400 to 800 international units of vitamin E a day, because it's sort of a blood thinner. Acts like a blood thinner. It also slowed the progression of heart disease by reducing the oxidation of LDL. Now for LDL, which is the bad cholesterol, to go from your blood into the walls of your artery, it must be oxidized. Oxidized. So if you got a lot of antioxidants in your blood, vitamin C, vitamin E, all this stuff, then the LDL cannot be oxidized and it can't go across and cause a plaque. And this is the Lancet, which is one of the best journals in the world. I know because we've had an article published in there, haven't we, Dr. Ryan? So, called the Chaos Study. Increasing the intake of magnesium, calcium, chromium, very important here, especially if you're diabetic. Helps this glucose get across the cell wall. Manganese and other trace minerals might prevent 150,000 cardiac deaths per year in the United States. But do you hear this from them? Nope. Statins, all this other stuff, biotic, This is the National Academy of Science. This is the federal government says this. 1 to 3 grams of niacin a day can increase the HDL, decrease the bad cholesterol, and lower your triglycerides and your cholesterol. Now, when you take niacin today, one thing people take it, they don't want to take it because it gives you this niacin flush. Anybody take niacin, and you get this flush? You keep taking it till you get through the flush, And don't drink alcohol or stuff because it makes it worse. But this stuff is really, really good. I've read a lot of studies about this, and Dr. Abram Hoffer is the god of niacin that proved that this not only helps mental diseases, but it also does this. Now, according to the American Institute for Cancer Research, 75 to 80% of cancers can be prevented. 40% from smoking, which causes all these free radicals that we know cause a problem, and 35% from the diet. Things that you eat that are bad for you, or things that you don't eat that are good for you. Now, the latest study from the American Institute of Cancer Research is sort of backing off this diet thing. I don't know if the drug companies got to them or what, but I was reading the latest book from them, and they're sort of backing off the diet thing. 192,000 women, and this is what kills me here, and about 2,000 men will be diagnosed with breast cancer each year. Did you know that men can get breast cancer? They get the gene from the mama, just like a guy. They got to have the radical mastectomy and everything else. We had a couple of patients here that we treated. I find this sort of irritating because 0 women get prostate cancer. In case you didn't know it, women don't have prostate. Some people are strictly, what is I talking about? That's strictly unfair. I was going to file a suit with the federal government over that, but somebody talked me out of it.
But isn't that quite low?
Well, 1 is high.
If you're that guy.
Yeah. That's what you say. You look at all these statistics from some of these drug companies, you know, there's something called statistical significance and biological significance. Like they say there's 120,000 deaths reported in hospitals from drug reactions, you know. And they say, well, you know, or 600 people die each year from statin drugs. But they say, well, the risk, I mean, is the benefit far outweighs the risk, unless you happen to be one of the 600 people who die from this stuff. Calcium, vitamin D was shown to inhibit breast and other cancers by enhancing cell death or apoptosis. This is what I talked about here. A cancer cell will, once it's formed, is immortal. You got to kill it to get rid of it. This is what I was talking about, that selenium. Total cancer mortality was reduced 50% of those taking 200 micrograms of selenium daily compared to placebo. And the risk of developing many types of cancer decreased 47 to 78 cents. This is, these are the journals. I mean, I'm not making this stuff up. This is coming out of the literature. So does it work? Sure it works. Alzheimer's. Anybody know anybody with Alzheimer's or something like this? Kills about 49,000 people in the U.S., 8th leading cause of death, national statistics. Patients with high blood homocysteine levels have 4 times the risk of getting Alzheimer's with faster progression of the disease. Now, homocysteine is also associated with atherosclerosis. It comes from the amino acid methionine, which is normal in your body. And what you can do to reduce the levels of homocysteine is take folic acid, B12, and B6. What it does is it gives a methyl group to the homocysteine, drives it back up to methionine. 4 millimoles increase in homocysteine in your heart atherosclerosis is equivalent to 20 milligrams increase in cholesterol. That's how more bad homocysteine is than cholesterol. Now the drug companies, you're seeing these reports coming out, they're poo-pooing the effect of homocysteine on heart disease and brain. Why? You can't patent folic acid, you can't patent B12, and you can't patent B6. So now you're seeing more and more articles coming out saying, homocysteine has nothing to do with it. Bunch of bull, it does. Does it work? 1 in 500 people in the U.S. over age 50 have Parkinson's disease, 6,000 new cases a year. And this is what we think about causing this. Increased oxidative damage where the protein in the cells are not being able to be breaking down, and then they turn into amyloid and they form plaques in your brain and you can't get the transmission going. Plays a role in many diseases. Vitamin A, C, E, CoQ10, which I think is a miracle. Omega-3 fatty acids. Now 60% of your brain is actually fat. So if somebody calls you a fat head, thank them. Thank your hand. Thank you very much. You know. So omega-3, omega-6 fatty acids are very important for your brain. We use for preventing and delaying the onset of neurodegenerative diseases, and there's about 5 or 6 references here. Now, amino acids. Your neurotransmitters in your brain are made from what? Amino acids. Your body cannot make 8 essential amino acids. So you must get them through your diet. If you're an infant, it's 10, but an adult, it's 8. So you got to get them through your diet. You got to get them through your diet, you got to digest them, and there's 17 different nutrients that convert amino acids to neurotransmitters. Nothing works in a vacuum in your body. Not one thing does something. It's a group of things that does something. So if you may be taking all this stuff and you're not going to B6, you're not going to be getting the effect. Worldwide, vitamin A is deficiency is cause of blindness in some countries, especially India. Trees for Life, remember that program here in the United States? This guy was growing these little trees over in India. The leaves, you put them in the salad, had vitamin A, reduced the blindness. Iron deficiency, 40% of the world population lack of iron. A child's IQ is going to go down 7 points. If they lack iodine, it's going to go down 13 more points, so you're going to lose 20 points right there of your IQ just by these two things. Folic acid causes 200,000 severe birth defects a year in 80 countries. Now, for years, in the United States, the medical community said it's crazy to think that a vitamin has anything to do with spinal bifida, till all these studies showed overseas that it really did. So instead of saying it doesn't help, they put it into flour and bread, so you got to get it now whether you want it or not. See how they work? That doesn't affect it. All right, now, by the way, you're going to take it whether you need it or not. Folic acid. And you're seeing statistics. If you go in the NIH, look up statistics, look up spinal bifida, it's going like this. The rate of it. Because spinal bifida is closely associated with lack of folic acid. Anybody? Iron deficiency causes about 18 million children to be born mentally impaired. This is mainly in the third world countries over here. This is why we add iodine to our salt. It's in your bread, to prevent the thyroid stuff and all this other stuff. When I was in China, it's about 20 years ago, I was consulting over there, and we was trying to find how all these people up in the mountains are getting goiters and everything. So we came with that. We'd go out and pour iodine in the well water. That way you get iodine. I'm famous in China. French government conducted a 7-year double-blind placebo randomized study where they used all these antioxidants and against these people who took a placebo. They found a 37% reduction in cardiovascular deaths, 30% less cancer diagnosis in the men. So the summary, oxidative stress. More oxidants may produce than antioxidants, may be responsible for many problems associated with aging and the onset of degenerative diseases. Proper diet, proper digestion, absorption, metabolism, and excretion. Supplements may delay the onset of this free radical damage. This is why you see people 40 going on 80 and people 80 going on 40, right? Because it's their level of stress and the level of antioxidants in your body. How do you know how you have enough in your body? You must measure the levels in your blood. We have a program called Answer to Your Question. In fact, Dane, if you turn off this screen again, I got another overhead. What's he saying? Turn it off myself? See? Pay these guys to come out and press a button for me. Be still. Get back in there. We have a program called Health Hunter Beats the Odds where you can come out and actually measure the levels. It's like doing the dipstick before you put oil in your car, checking your gas tank. How do you need it? How much do you need? If you're over here, you don't need anything. It's like a gas gauge. Here's your gas gauge. If you're over here, you're almost empty. You need to do something. You need to do something quick. This is vitamin A, and this is vitamin E. Same thing here. You want to get over here. You want to be over here in the optimal range. If you're over in the optimal range, whatever you're doing, keep doing it. If you're over here, you're getting in deep doo-doo. You need to do something. You need to do something, and you need to do something quick. And what you do is after you do the test, you will get this back in the mail, telling you what your level is, what the optimal level is, what the normal range, and what you can do to correct it. So you're measuring the dipstick in your body to see how well your oil and your gas and your energy and everything is. Your body is very similar to a car, You need gas, you need energy, you need spark plugs, you need electricity, So you need filters. You got liver, you got your spleen, your filter, all this stuff, the ATP. So all I'm asking is to treat your body as good as you treat your car. Is that too much to ask? No, okay, good. She said no, good. Okay, Dean, I'm going to go down to the next one. You want to turn this off? I can do this button. I can't do those buttons. Okay, now, this is what we started off with. This is what we have. Does everybody know the definition of a free radical? Raise your hand. How many people don't know the definition of a free radical? Leave the room. Do you know where they come from? Right? Stress, all this other stuff. You know how they damage the body or protect the body. Right? You know some diseases caused by free radicals. We talked about those, right? Do you know how to diminish the damage from free radicals? Raise your hand. I've failed this lecture. I'm giving you all the F, by the way. Cell dynamics and free radicals. So that's the end of the lecture. Thank you very much for coming. And I'll be open for questions.
Wait for the mic.
And don't nobody leave yet because we're going to have a drawing. You get to have a buy me dinner if you win.
Okay, I have a question. Is niacinamide as good as niacin?
In some cases it is, and you don't get the flush.
Yeah.
Yeah. Dr. Ron and them orders that a lot.
In your list of
Speak up, please. I got a hearing aid.
in your list of stressors, you mentioned radiation. Would you consider microwave radiation, i.e., cell phones, harmful to soft tissue?
There's some data coming out that there is. If you got somebody who has a pacemaker in their thing, what does it always say around a thing? If you have a pacemaker, do not come near this microwave because it's going to. Yeah, there's some data coming out about the cell phone, especially in Europe, causing problems. But any type of radiation will do it. That's how they kill cancer with X-rays, is the radiation. It's produces oxidants and kills the cancer cell. Next. Him again.
Wait for the microphone.
I'll charge him extra $5.
I never heard you mention anything about meat.
Well, did you have meat?
Is there antioxidants in meat?
Yeah, there's some. Yeah, there's a list I have up here of some things. I don't have a whole lot of them, but if you're really interested. Protein has a lot of things to do with it because proteins is where you get a lot of your amino acids from, and it depends on what type of protein. Egg albumin is called the perfect protein unless you're allergic to eggs because it breaks down. But meat has a lot of fat-soluble vitamins in it. It's good.
What's the story about the absorption of pills you take?
Well, it depends. Upstairs, with all of our medicines, we got to have all of our pills we sell. You got to have an independent lab study saying that this thing contains what's in there. If not, we won't buy it. I remember doing a study in graduate school where this professor, pharmacist, gave us 5 different aspirins from different brands, real cheap to real expensive, and he said, "Put these in little glasses of water. All right, come back in an hour and check them. Real expensive ones start to dissolve. These over here were still solid. All right, come back in another hour and see what happened. The real expensive were almost down to powder. These things are still solid. All right, come back the next day and see what's going on. There's one of them that's still solid. So they push a lot of pressure on it. So yeah, you get what you pay for. A lot of people now are trying to sell you all these antioxidant drinks and stuff like this because they're going to improve all your stuff. But how do you know what you need?
And those upstairs have been verified by...
Yes, there's a book there. You can look in the book and look them up. Because we only buy good stuff. And only sell good stuff. Only take good stuff. Any other questions? One more question? That's it? No question? Okay. You have to pay me more money. Uh-oh.
One more question?
This guy's got a tough...
you talk about the oxidation.
Right.
Why does it happen just in certain spots, like the skin spots? Or
It happens all over. That's why you get
Right.
cancer.
Well, how come you don't just turn brown instead of having a spot?
Because you got antioxidants in you. You're eating good, or you're doing something, or your gene. See here, in 2 years, my head's going to be rust.
Okay.
Because of these things.
So but why does it happen in just one spot, in one locale?
Well, this is where the most of the oxidation is taking place for some reason. Maybe the sun hit there more often than not. Maybe your hat was cooked. I was in the military for many years, and I was out in the sun, I had a helmet and a hat you'd cook over. Maybe the sun's hitting you like here, in your hand, My arm's turning rust, Call me Dr. Rust here in another 2 months. But That's the reason, you know. And then everybody at the center, what we treat everybody's an individual. We don't come in and say, all right, you're supposed to be this. We measure you and say, you are this. You know, that's one thing we do out here. We don't take the the national. See, the drug companies are reducing the normal values down to a 20-year-old. They want your blood pressure to be that of a 20-year-old. They want your cholesterol to be that of a 20-year-old. They want your glucose to be that of a 20-year-old. Instead of having 2 standard deviations, now we're 1 standard deviation. So anybody above that is sick, and you got to have a pill. See, that's the thing behind that stuff. Okay. Anything?
One more question.
Dr. Ron, I got something for you.
How sensitive are the nutrition tests to diet as far as 24 hours? Do they reflect the last 24, 48?
Yeah, we fast. We want you to fast and come in at the last 24. Well, some of these things have a long half-life. And like some of the fat-soluble vitamins stay around for a long time. The water-soluble vitamins go quick. The minerals are for a long time. But we want you to fast to make sure what's going on in your body. But yeah, they stay around for a long time. This is why it takes, you know, people that are anorexic or people that starve, you know, you can live for a long time without food. You can live a little bit without water, but without oxygen, you're dead in 3 minutes.
So if you're on let's say you've started a supplemental dietary program, how long should you be on it to measure the effectiveness of changes you've made?
Depends on the individual and depends on your absorption. You say you have absorption, right? What we do is we do this program every 6 months. We do it in April and October. And what you do is you measure it, see how you were then. Most nutrition things takes about 3 to 4 months to really kick in. So you really need to give it time. People say, well, I'm taking this stuff, Dr. J, it's not helping me. Well, God, you've only been on it 2 weeks. You know, it's not like a, you know, antidepressant where it's going to...
The preceding program was presented by the Center for the Improvement of Human Functioning International in the Bright Spot for Health Lunch and Lecture Series. To inquire about additional health-related information available on DVD, audio CD, VHS, or audio cassette, simply call 316-682-3100 or drop by 3100 North Hillside in Wichita, Kansas. To discover more about the center and what we have to offer, be sure and visit us on the web at www.brightspot.org.